Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I want to introduce everyone to my next guest, and this is Chris OSBORNE. And Chris is president of Prescription Pad Pharmacy and Medical Plaza Pharmacy. And I've always wondered why people become pharmacists. I mean, are they just interested in medication? Was it their father was in the business? So I'm going to ask that of Chris. So Chris, why are you a pharmacist, and what's going on there?
Hello, how are you?
Hi.
Well, I kind of fell into it. Originally I was a pre-med major in college, and then I didn't want to go to school all that time, and I wanted to stay in the medical field, so then I fell into pharmacy that way. So and I worked, I think before I went into pharmacy school, I worked the summer before I went in just to get some experience, and you know, it was a positive experience, and so I just went with it.
Right, and I think the positive part is being a small pharmacy. We know that we have the giants, and it's so impersonal. It is. I'm so glad to know that you are doing this on a small level, because you probably know every person who comes in to buy a medication, don't you?
I do. I know everybody that walks in through the door.
Yeah, and I think that's what's missing. I think it's missing in a lot of relationships today. So how long have you been a pharmacist?
Since 1998, 20 years.
20 years, and he's pretty young. He's under 50 anyway, so that's a great thing to do. And do you have to be there all the time, or do you have other people that can make those potions or the compounds?
Yeah, I'm here pretty much a solid 4 days a week. In the very beginning, of course, I was working like 6 days a week, but now I'm to the point where I can kind of work 4 days a week and still get, oversee everything. I mean, I have people here. This place runs like a fine oiled machine.
You must be a good guy, because it doesn't happen casually.
I have a lot of good quality auxiliary help, so that's very important.
Well, this is like an odd question, I guess, because I always ask odd questions, but this whole opiate problem, people who they probably came in with their scripts for years and you filled them. What are there different laws now? What changes have come about?
Well, the law really doesn't. It changes in July. There's a lot of new regulations coming down as far as opioid prescriptions. There's laws regarding acute opioid, acute pain prescriptions. Like, say you go to the hospital for a broken leg and the doctor prescribes you some Percocet. Well, there's new laws. There's laws that are going to be regulating how much we can dispense, and how do we go about verifying that it is for acute pain versus chronic pain. And so it's to help combat those pills that you don't want on the street. So,
but someone could get them and then wind up giving them to other people. You can't prevent that. Right.
Well, that's the thing. Like, say, before a doctor would write for, say, 60 Percocet when you came out of the hospital. Let's say you only took 5 or 10 of them, and the other 50 pills lay on your shelf for a year or two. And then what happens is you either take them again when you feel like it, or you say to your neighbor, "Hey, I got some Percocet laying around. You need some? I know you got some back pain." And that's how things happen. So they want to limit those extra pills that are just laying around somewhere, and just really cut down on it. So I think it's a good thing. It's going to be more cumbersome here at work trying to get used to all the new regulations, and the workflow is going to change a little bit. But once we get through that hurdle, it'll be back to normal. I mean, back to like a routine.
Right. It's funny you should mention that, because I told Chris when we first started that I go down to Dr. Soto in Plantation, because I think he's a fabulous dentist, and when he does, I've had a lot of oral surgery. He always gives me a prescription for something. I'll say, well, I really don't need it. He said, well, just take it in case you do. I never fill it.
Right.
because I don't want to take things like that. Or he'll give me something that's just over the counter if I want it. Before I leave his office, he'll do it. And then I just get a cold can of Coke and put that on my swelling. It never swells. And he is such a good dentist, I never have pain and I never have infection.
Well, that's good.
Right. So I'm not going to be a good customer for that, but I'll tell you what I would be a good customer for. And I notice on your website that you do something that a lot of the pharmacies don't. You do compounding.
Yes, we do. We do custom compounding. We do non-sterile compounding. We don't do the sterile compounding, which requires a lot more. It's regulated as far as the sterility and a clean room, and it's more for like injectables and things like that. But we do like the topical creams, the suppositories, the magic mouthwashes,
Wait a minute. What's a magic mouthwash?
Like, say you go to the dentist and they prescribe, say you have some, or, ENT doctor or dentist, and say you got some bad mouth ulcers, or you have thrush, or you have something going on in your mouth and very painful. What they'll do is they'll prescribe called a magic mouthwash. And what it is like 3 or 4, even sometimes 5 ingredients. And there's like a combination of lidocaine in there, Benadryl, and maybe an antibiotic, or an antifungal, maybe a steroid. So all different, percentages and concentrations. So, and not a lot of pharmacies do that. So we do that, and and it helps the patient a lot as far as their pain relief and what's going on in their mouth.
Right, and that's what we're going to put in the May issue. We're going to do a whole thing on compounding because I needed to have some compounding at one point, and then as a gerontologist, I know that there are a lot of people who older adults cannot swallow pills.
Right.
And so what do you do for people like that?
Well, we can make we can pretty much turn anything into a liquid, a suspension for people. We flavor it, depending on the medication, but a lot of medications can be crushed and put into a palatable, liquid suspension.
Right.
So yeah, we can do that. We also do that for animals too, like dogs and cats. We put a lot of because they take very small doses of things, like say dogs and cats do take human medicines also. So we'll take like a couple tablets of a drug, crush it up, and put it with a solution, and make it a small concentration so they can take it also. So yeah, we do that too.
You were reading my mind. I have my dog here in the radio studio, and they just told me that he has Cushing's disease. And
Right.
so he just started this morning on a tiny little pill, and I put that in a little pill pocket, and he took it with no problem.
Yeah.
But you actually will make those things for the dogs?
Sure, we'll take that. Let's say the doctor can't swallow. The dog or cat can't swallow a pill, or the concentration is just too small. We have to, improvise, and we make it into a liquid for them. And you just squirt a little tiny solution into their mouth, and that's it.
Oh, that is so good. I hope everyone's listening to know this, because some of my other pets before would not. Oh, they would bite me if I got near their mouth with anything. He's not like that. But
Right.
But I think people who are listening now, if they thought they could go where you are and be able to have it formulated. So what do they bring you a prescription and then you make it?
Yeah, they can bring it. The doctor can call it in. They can fax it. We even tell people they can text or email their prescriptions. Make it as easy as possible. And so, yeah, we'll look at the prescription. We'll come up with a price, and then we'll let them know. And if they want to go ahead with it, it's usually a 24-hour turnaround time.
Wow, that's great.
We also, if in case you can't get anything in the pet's mouth, we do something that you rub inside the ear.
No kidding.
And it absorbs that way too. Yeah, it's pretty neat.
Oh, this is wonderful. It's funny. Yeah. I have to assume you have pets.
I have a dog, yes.
Right.
I have a little Yorkie. Yeah. But yeah, so there's little different ways to
So wait a minute. So tell me, so that's because The ear is so sensitive that it
Well, they
can...
have a well, they have a. Typically, cats and dogs have a large surface area,
Right.
inside their ear. So, and there's no hair, so you can put a transdermal cream inside the ear, and it will absorb the medication.
I think that is just a great idea. I mean, I wonder if all vets know this. When I see my vet next, I'm going to talk to him about that. He may not know that because he didn't know that my dog would take this. They just prescribed it, and that's the other thing I have a question about. So normally a doctor prescribes something and you go to a pharmacy, but vets seem to have it right there.
Yeah, sometimes they'll sell out of the office.
Yeah, he does.
They do it. It's a good way to make a little extra money for the office. But sometimes you can find the same medication,
For less money.
for less money.
I was just going to say that to you because he did give me a supply because he wants to check it over in a couple of weeks to make sure that it's working okay. But before I buy any more, and I have the name of it, so I would be able to tell you the name, and you would be able to.
I could tell you one if we can get it, because sometimes veterinarian medications can only be supplied either by a veterinarian or
I
a
see.
veterinarian pharmacy. There's like different types of meds that you have to have a special license for, but there's a lot of meds that they dispense, like say a med like tramadol, which is used for pain, and they use it commonly in dogs. We sell that here, and it's very cheap versus buying it from the vet's office.
I'm sure going to remember that. I'll tell you
So
because.
yeah, I mean, I just tell people, before you make that decision to buy at the office, just call,
Right.
and we can tell you, yes, we have it, and yes, it's this much money, and that's it.
And I'm going to give that phone number to everybody right now. I am talking to the pharmacist, the owner, Chris Osborne. He's president of Prescription Pad Pharmacy and Medical Plaza Pharmacy. They have two different locations. Their phone number at 333 Northwest 70th Avenue in Plantation is 954-791-2000. And the Medical Plaza Pharmacy and Medical Supply in Plantation at 201 Northwest 82nd Avenue. And that's inside, actually. It's inside Bennett Medical Plaza, right? That's the different one. That's 954-474-3887. Now, the nice thing is any new transferred prescription, you will get $5 off if you tell them that you read it in Boomer Times. And the other thing I see is you have, let's see, how do you pronounce that?
Sildenafil.
Sildenafil. Sildenafil.
Sildenafil. It's the active ingredient in Viagra.
Ah. And it's only $2 a tablet? You must be kidding.
No. And what happens is Viagra is so expensive. It's like brand Viagra now is like $70 a tablet.
Oh, my goodness.
It's really crazy. So the sildenafil, we sell it for $2 a tablet.
And that's really what Viagra has in it?
Yeah, that's the active ingredient. That's what makes
No kidding.
That's what makes it work.
Well, you know what? Maybe the next article next month should be something on that because I think that's amazing. So I could maybe do a little thing on sildenafil and then show $2 a tablet compared to $70. You must be kidding.
Yeah, no. The strength. The 100 milligram Viagra tablet's about $70 a tablet, and it just recently came out generic. The 100 milligram, and it's about say $40 a tablet. It's still expensive.
Yes.
But we sell sildenafil 20 milligram tablets for $2 a tablet. So if you're taking, let's say, 4 to 5 tablets of those to equal your normal 100 milligram dose, you're still only spending the most at $10 a dose,
right?
Versus $40 or $70 a dose. So it's still worth it.
Yeah. Well, I'll bet. Yeah, and I want to ask you a question. So, because
most people don't take the full dose, and they don't need that much.
Huh. I bet you do feel like a doctor a lot, because I'll bet people do come up to you, they know you, and start asking you about questions, medical questions, don't they?
Oh, absolutely, all day.
Because I don't think you could become a pharmacist without really studying a lot of things.
Yeah, no, and I have my doctorate. I have my PharmD, so I have my doctorate in pharmacy. And a lot of times we're the face that everyone sees before they even think about going to the doctor.
Yes.
And then they'll come here, and then eventually we can refer them, or no, just take this over the counter, you'll feel better. You know what I mean? It all depends on what the issue is.
That's really great. As a matter of fact, it's funny that a lot of times, and I know this, people say, I'm going to go to the pharmacy and see what they think. Well, if you go to one of those big box stores, you can hardly find the pharmacist, and it's not the same. That's what I think you have going. That is so wonderful.
Right, yeah. The big chains, it's a different person every shift. You don't get the same person. They're busy, and
right.
They're way tucked back there, and for them to come out on the floor to talk to you probably take like a presidential order.
Right. Let me also ask you a question. Since you have a dog, and hopefully it doesn't have Cushing's disease, but would the same prescription, if let's say a human has Cushing's disease, are they going to get the same thing that a dog gets?
Sometimes they use a similar medication, yes. Uh-huh.
So how much do you know about Cushing's disease? Now I know I'm pushing you now. Because I hated to put him on something.
Right. What they put him on, spironolactone, or?
I didn't even see the name. It's a tiny little white pill, but that doesn't tell you anything. Yeah. It's a capsule.
I mean, it's it's a condition that affects humans and animals.
I was thinking, frankly, my dog's in such good condition, he doesn't have any of the things that they said about panting, or I don't see that, and I don't see urinating a lot, and I don't see, anything. And so I always thought, I don't want to do this. I don't even want to get him started on it. I have that attitude. Is that a bad attitude?
No, it's not a bad attitude, but
they did take his blood. They did see it there. I mean, so
what his cortical system is way off. So
yeah, that's what it is.
And that causes a lot of problems. High blood pressure, like you said, panting, muscle weakness. There's a lot of problems that can happen from that. Anxiety, depression, irritability. So, and the main thing is the high blood pressure. The heart,
really.
So that they want to control that with the medication.
Mm-hmm. Well, and it's funny. I have a pill I'm taking in the morning that he's taking in the morning, and then one at night. There's different. So we're going to try it, and then they're going to want to take his blood and see how it's doing.
Oh, okay, that sounds good. Yeah. They just have to keep monitoring him.
Yeah. Oh, really? All the time?
Yeah, because you want to make sure the medication's working. You want to see if there's an increase in the cortisol levels, if the levels keep going up.
Yeah, that's what they said. Just what you're saying.
There could be a tumor there. There's a lot of different things that cause.
Yeah. Yeah, that's what they said. Well, it's just awfully wonderful talking to you about this, because I don't really have a real pharmacist that I know that I can. Most people don't. It's so great that you have this and that you have your stores. So for people who are looking to have their own personal pharmacist, why don't you think about going and meeting Chris Osborne? I mean, that's really a lovely thing to do, and it's easy to get to. Plantation is, it's very easily accessible. It's a beautiful area in Plantation. And so we have 2 stores that you can go to. The phone number that you can, just write this down. Remember, I always say this is Pencil Talk Radio, so that now, if you have a problem, call Chris. And as a pharmacist, he'll tell you what he knows, and I'm sure he'll recommend the right thing to you. So his phone number is 954-791-2000. That's easy. Write that down, and you'll have it. We have another one, too. I'm not going to give you the other one right now. Just take one number, and if you're not at one, will they get you at the other?
Yeah, but I'm mainly at this number. Though.
Yeah, the 2,000.
Yeah.
Right. Well, that'll be very good. And remember, those of you who are taking Viagra, my goodness, you could have a real deal on this one. So you want to go and talk to him about what he has. The other thing that, because we still have a little time, I just want to talk about, you have a lot of medical supplies there, which I think are very important. You have like canes, wheelchairs. What else
Right.
do you have that people, as one ages, needs?
Sure, we have knee scooters. Knee scooters are good because when people break their ankle or do some kind of damage to their lower leg, preferably the foot or ankle area, they can't be on their ankle, so they'll rent a knee scooter from us.
An e-scooter.
A knee scooter.
A knee scooter. Oh, I've
Yeah.
seen people. Oh, they have a knee on this thing, and they.
Yeah, the knee's on there, and the foot kind of dangles off the back, and then
Right.
you push with the other leg.
Oh, and so who's using those? What are they? What?
Typically, people who go to a podiatrist and have either surgery done or something going on with their foot, and they have to be off their foot for several weeks, and they don't want to use crutches because crutches are so cumbersome. They hurt underneath your arms. But the knee scooter is great. We rent it from $80 a month.
Oh, I see. So it's a
Yeah.
rented thing that you.
Yeah, we can sell it too, but I mean, typically people like to rent it, and
Sure.
because to buy it, you're a couple $100.
And then you don't need it, hopefully,
And
after.
then you won't need it
right.
after that. So yeah, they typically like to rent it. So, but yeah, we do that. We rent wheelchairs, transport chairs.
And you have the stockings. What
We
are
have
the compression stockings?
Yeah, we have compression stockings, the support hose. If you come in, we measure you to get you the right size, and we have a good selection of those. And if there's a size we don't have, we can always custom order it for you. Yeah, we do that. We offer free delivery too.
Oh, that's a very important thing. So how far? Anywhere in Plantation, or how far would you do that?
Plantation, Sunrise, Davie, Tamarack, all the surrounding areas, pretty much.
Is that right? So if someone calls in for a prescription, can they get it that same day?
Yeah, we typically tell people that if they need something delivered the same day to call us before 2 o'clock,
Mm-hmm.
and then they'll have it, unless it's like an emergency or something, like
Right.
an antibiotic called in late or something. But yeah,
That's very important. See, now that's what the seniors really need. That, because if you're an older adult and you don't drive, how are you supposed to get your medication? You have to get someone to get it for you
sure.
or drive you. That's great that you do that, Chris.
Yeah, we offer compliance packaging also.
What does that mean?
Like, say some seniors can't remember to take their medicine or when they took their medicine last. We put it in blister packs, the medication, so you can push it out. You push out the day that you need, and it's really good. We use those a lot in like assisted living facilities and group homes. It's easy to keep track of the medicine, and so a lot more seniors are using that service.
Well, I know they do that in senior communities and all, but I didn't know that you will do that for someone.
Sure.
So you'll say that just an average person lives at home, and they're on 3 medications, for example, and you will then put them in blister packs so that you make it very clear that they know that day they have to take it, and if they forget, they'll see that it disappeared from there, right?
Sure, absolutely. Yeah.
I'm glad you're doing that. See, now, regular pharmacies wouldn't do that. I mean, that's the difference of going.
No, the big chains.
Yep. They won't
get
do
into
that.
No.
I'm really glad that you really take this very seriously. It's are your parents around?
Yeah, they live up in West Palm Beach.
Oh, they do.
Yes.
That's where I'm coming from, Boca right now. So they live in West Palm Beach, and I'm sure they're very thrilled with your having the pharmacy. Are they asking you to open one up here?
Yeah, it would be nice, but it'd be tough too.
No, you can't do that. There's no point in starting that. But I'll bet that they'll tell you about that. There's not very many pharmacies run as you are.
Right. No, there's very little of us.
And that prescription pad pharmacy, is that a franchise or it's a great name? Are there others?
No, I think there's one out in like the state of Washington, but it's just coincidence that someone else has the same name. But no, it's just this store has been here since 1984.
Oh.
So I'm not the original owner. I'm the third, I think. Yeah, the first owner only owned it for a couple of years, and he sold to the previous owner who I bought the store from. So he had it for 18 years, so I've had it for 12. So yeah.
Well, so you can see that it must be really well known, and people love going there, and that's great. Well, just thinking back about what we were talking about, so compounding is something if people want to do that, or people want blister packs, or if you're looking for certain kinds of your medication. Oh, I know what I want to ask you. This whole thing with, well, we're probably running out of time. I'll have to do this next time. But medical marijuana, are you carrying any of the marijuana, that CBDs or any of that?
I don't carry the medical marijuana because there's only a few companies that can do that, and you have to have a certain license for it. And right now, there's a moratorium on dispensaries, like additional dispensaries.
Mm-hmm. But there are things that you can use that you don't need a doctor for. You know, there are all these...
Right, yeah, and there's a product called CBD, which is cannabinoid oil.
Right, exactly.
It's made from hemp.
Exactly, from hemp. So are you carrying any of that yet?
Not yet, but I will be in the future, yeah.
Very important you let me know about all that. That's wonderful. Well, Chris, we've certainly we've done a good job here. I thank you very much for taking your time. And we'll have you on YouTube within 3 weeks, and well, also your article I wrote on compounding will be in our May issue.
Awesome, great.
Thank you so much. It was great meeting you over the phone, at least.
Yeah, thanks for having me.
Okay, thank you, Chris. Bye.